Hello. I almost said good morning because I literally just landed here in Berlin from Lisbon, and I've been awake since 4 a.m. So good afternoon in whatever language you speak, and welcome. Thanks for being here. I'm sorry I've missed so much of it. I'm really excited to tell you about Asterisk. We chose the name because it's a little bit tongue-in-cheek. Women are considered asterisks in the medical field with regards to modalities and dosages. For example, the Ambien fiasco earlier in the aughts, where women were left out of clinical trials, only to discover 20 years later that the dosage was literally double what women should be taking, and thus they were having episodes. So now there is an asterisk next to the dosage. If you are a woman, have the dose. Women are also 50% more likely to die from heart attack than men, because we compare women's symptoms to that of men's. Women's heart attack symptoms are not typically the shooting pain down the arm and things like that. In all, women's health is simply under-researched, underfunded, and especially within the non-reproductive space. The numbers, as I've said, bear this out. 20% of women say they've been dismissed by their doctors with regards to their symptoms. I'm fairly confident this number is higher, but this is what the data has been able to prove so far. 74% of sex-specific research is going towards men's health, and only 2% of novel medtech startup funding is going towards women's health at all. So what we want to do about it here at Asterisk is to basically shake things up, revolutionize the space. We have a few different tiers that we are exploring right now as verticals, and we intend to diversify from here, but I'll tell you what we have so far. So just take a note that I'm calling them stages, not really that they have to be in order, but they could really flow together. So the first is to explore funding novel research that isn't necessarily product-driven. We know that when large corporations have gotten involved, as they have been for the past several hundred years, they're really looking to make a profit, which means that we miss out on a lot of the potential revelations that could be really useful to build upon for women's health. So we're looking to snowball research. We're looking to invest in research that really matters to the members of the DAO. So for the first time, we have the opportunity for patients to be voting on what research matters to them and to their potential health. And then mint research IP NFTs. This could be for research that we have funded or perhaps not. We're looking to explore how to build out a library of data in order to then again start to snowball the research in order to really fill the enormous gap that exists right now. Stage 2 could operate independently or alongside the research. So funding femtech startups. Currently, 80% of femtech startups are focused on reproductive health. And again, I've got the bits too. We need better visibility into women's reproductive health. However, there is a massive gap in understanding for new technology and novel innovations for non-reproductive health. And I'm really excited to be in this space in order to further this. We can release funding much faster, and we can also take the research that we are developing and funnel it to the startups. One of the major complaints that we hear within the femtech space is that there just isn't enough research in order to create the technology or prove the models that they have. So if we can help them with that, then we accelerate that space as well. Stage 3 then would either, again, exist independently or alongside in this direct stream. So again, snowballing the data, building out a data pool to create perhaps a licensing pool for us as well as for researchers And we are really indicating that we want to be looking at a global space with regards to this. Women live all over the world, surprise, surprise. So women's health cannot be white. Women's health cannot be Northern European. Women's health has to be fully global, and we're really passionate about that as well. Being a DAO means that funds can go around the world, and it also means that we can license around the world. And that, to me, is one of the most exciting parts of Web3. The funding is bearing out. The market really recognizes that this is a space to grow into, but it is early days, so the solutions have yet to really be grown. But over the past year, we've seen women's health funding in the United States grow by 121% just in the last year. So to me, it's really exciting to see that the gap is so big, but the funding is starting to come, and I think that's a really exciting place to be in with regards to the startup space and the DeSci space, because this is a place that investors are looking since we're still a rather young space. To that point, with regards to what DeSci looks like, you've been here for the past day and a half, so you pretty well know. We're a small but growing ecosystem. There are 24 DAOs that are funded at this point. There are many more that are on the track to be funded. And so for me, again, the DeSci space is very exciting because it is still a baby space, let's say, and we have a lot of opportunity to take up this space and to innovate, not just for women's non-reproductive health, but then also to be putting a stake in the ground for what DAOs can do within the DeSci space. So where are we right now? We launched only a month ago. So we ourselves are a baby DAO. We are currently building out our governance model and exploring what business models, what verticals could we be going in. So the 3 stages that I showed you, these are pretty well explored spaces. We're pretty confident that they will work. We're also really curious about what else could work. What other business models have not been explored in DAOs, or maybe could we create ourselves. We're also building out our membership, our core contributorship. It needs to grow in order to, of course, be able to do what we want to do. So with that, we currently have 4 founding members across the world, taking place mainly in Europe and in the United States, which, as you can see, I'm very passionate about expanding that space around the world, across continents. We are looking for more core contributors in the medical sphere, core contributors to start the working groups, as well as a super passionate community manager. Our first working group that we really want to roll out is the research group. For me, I believe that we need to not just do the work, but also to be a resource. And so we need to know what's happening in the space, but I also want to be able to share what's happening in the space with the general public. So not just with our members, but actually really truly become a resource for non-reproductive health. What's happening, what is new, what is interesting, and what impact could this be making? New research could include, the latest fiasco, we might say, where they finally, for the first time, tested tampons and pads with real blood. We also want to, yes, we're very excited about this. We also want to look for gaps in care. Again, we're really, really interested in innovating our business model. And so this article in Nature just came out last year, and it stated that not only are there sex-specific gaps within human clinical trials, there are sex-specific gaps within animal clinical trials. And so for us, that tells us that our potential opportunity within the research space is maybe 2 to 3 steps before we thought it would take place. So that's exciting, and then also a little bit disheartening at the same time, because there's very little regulation with regards to sex-specific animal trials at this moment in time. Literally, the first laws have been going into effect in the past few years. and then a community manager to help us to put the word out, not just about the DAO, but then also to share the research that we are funding, share the research that we are finding, to help us to plan our events, and then also to help us with the I Am Not an Asterisk campaign. We're sharing women's stories, again, around the world to prove the point. This is needed. So if either of those opportunities sound great to you, or you simply want to stay abreast with what's going on, maybe pun intended, you can scan the QR code that will take you to the website where you can either fill out our membership form, join the Discord, or sign up for our newsletter in order to continue to stay in contact with us as we grow. That's what I've got.
Thanks, Veronica.
Thank you.
Do we have questions from the audience?
Can you explain a little bit about what non-reproductive health means and where you draw the line between like what is reproductive health and what isn't?
That's a really great question, and it sometimes can get blurry. However, for me, there's so much going on in the reproductive space already, and our bodies tend to be politicized when it comes to reproductive health. And so we want to stay away from politicizing our health in order to simply say we deserve to, not die more often from heart attacks, or be 25% less likely to get a stroke diagnosis when we have a stroke. Like, these are just problems that need to be addressed, and they don't have to do anything with baby making. But there's also disorders that affect women specifically that are to do with our reproductive system because we have it, but aren't about making babies. For example, premenstrual dysphoric disorder, right? So for half the month, 12% of women are in a state of deep depression, dysphoria, and even suicide. And that doesn't have to do with making babies, but it is influenced by a sensitivity of hormones. We also really are curious about what happens with hormones with regards to medication. We're getting curious around longevity studies because our hormones affect medication, but we have to go through many cycles, many months, in order to see how is this medicine going to affect women's bodies. So we're exploring what happens when we have these reproductive capabilities, let's say, but we are not exploring how to either improve pregnancy capabilities or things related to that. Does anyone need the QR code still, because it went away? Any other questions? Do we have time? Or are we done? We have 5 minutes. Any other questions? Yes?
How are you funded now?
Oh, we are pre-funding. Yes, so we're currently at the stage where we are working on our white paper, building out the business model. Yeah. Yes?
Maybe I'm coming from neuroscience background, and I think there is plenty of things to explore there. So especially when you have novel rapid antidepressants, then it was very clear effect with like different chamber animals that sometimes the drug did not have effect at all, or just half the effect. And that aspect would be very valuable to look into.
Yeah, so looking at how sex affects the efficacy of different...
And it might be totally non-reproducible system related, but something that they don't know yet, or how we can complement that drug could actually work into an organ.
Right, we have very, very, very little visibility into this at this moment in time. And so, again, I think this is a really fantastic business model for us to, and a vertical for us to explore into. Yeah.
Cool. Let's give it up for Veronica.
Thank you.